Hi, my name is Dr. Linda Stevens. I'm the owner of Stevens Family Chiropractic. I've been practicing the Gonstead system of chiropractic for over 19 years. Today I want to talk about what it is and why we do it. So the first thing that we're going to do when a new patient comes in is we're not going to only do the orthopedic and neurological tests. We're going to do the whole Gonstead analysis. Now what that entails is, first of all, we're going to use our nervous scope. And this is our nervous scope, also called the scope or instrument. And what we do is we're going to run this instrument down the whole entire spine. We're going to mark the areas that the needle actually breaks, and that's going to show us that there's some inflammation or irritation in that area. So then we mark those segments, and then we're going to come back and do the next thing, which is we're going to palpate the area. The palpation will tell us, is there tenderness? The patient will let us know that. Is there inflammation? Because you can feel that on the spine. And also, is the bone moving? So we can take it through some ranges of motion, and that will tell us if the bone is fixated. A fixated bone means that it's probably subluxated and it needs to be adjusted. From there, we're going to go ahead and x-ray the patient. Now the reason why everybody wants to know, why do we have to x-ray? So I'm going to show you on an actual x-ray why we do it. It's not only to look for the abnormalities, but it's also to do all of the Gonstead analysis, which is the line drawings. So we actually, when we look at the x-ray, we're going to do different line drawings on it to actually tell us, is the pelvis up or down, in or out? How are the lumbar vertebrae? We're just talking about the lower back right now, but how are the lumbar vertebrae rotated? Is it left? Is it right? Is it up or is it down? So all those things are really important because it tells us how we're going to make the adjustment. We want to be as specific as possible. If we're not specific, the patient's not going to get better or they're going to get worse. So after we do our analysis, we'll actually write that on a person's chart or in the computer that we use now. And they're called listings, and that tells us how we're going to make the adjustment on the patient. So after that, we actually are going to go in and adjust them, and how we adjust is also a little bit different than most techniques. So the first piece of equipment that we are going to use is, it's called the cervical chair. And the cervical chair is where we will do our neck adjustments. We want to do it in the cervical chair, or we can do it face down. And the reason is when we do the neck, most people will have either a straightened curve, a reversed curve, which we'll go into later on our later videos. But what it helps us do is get the bone pushed forward and use as little rotation as possible. So that's what the cervical chair will allow us to do. So we do the neck there, but we can also do it on our next piece of equipment, which is the high-low table. The high-low table is a table that comes up high and goes down low, which is why it's called the high-low table. It's easier for the patient to get on, especially when they're in severe pain. We can make any adjustment in the spine on the high-low table from the neck down to the pelvis. So we can do any adjustment on there. It also is very helpful for a pregnant female, because what we can do is we have a section in the table that will go down, and then we have a section that can come up, so the belly can hang down and not have any pressure on it, so that we can make the adjustment on them. Now the next piece of equipment is the knee chest table. And the knee chest table is somewhat similar to the high-low table in that we can make any adjustment from the neck down to the pelvis on the knee chest table. Again, it helps to open up the spine so that the bone can actually push forward so that we can set it forward. We don't use it all the time. We have to determine, every patient's different. Some will do better on the knee chest, some will do better on the high-low. So we know that as we make the adjustment with the patient, if it doesn't move correctly, then we'll try the next piece of equipment. So our last piece of equipment we're going to talk about is the pelvic bench, and that piece of equipment we're going to do the low back and the pelvis on. Those we usually will do in the side posture, but again we can do them on the high-low or the knee chest table. Now this table can actually come in different heights, so the doctor is able to get over the patient and get a good contact. Also, we want to make sure that the patient doesn't slide, so that's why these pieces of equipment always have material on them. And that pretty much wraps up what the Gonstead system is. And the reason why we do this system is because number one, it's very specific. And number two is Dr. Gonstead always said, find it, fix it, and leave it alone. And that's how I feel. As far as every patient is different, we're going to have different types of adjustments for each patient. How many treatments they have, it's going to vary between each patient. No one person is the same. So we really want to get the problem fixed, get them out of pain, and then see how they do. And they get to know when they need to come back in. Some people will come back in monthly, some people will come back in every couple weeks, and some people will come back in once a year. So it really just depends on their spine, how they're holding the adjustment, and that's why we do what we do. And I love practicing the Gonstead system because of its analysis and its specificity, and I hope everybody has a blessed day.